In April 2010, Neil Cormican was in Antrim Area Hospital where he was recovering from a fall. But an overdose of potassium, a drug his family say he shouldn't have been prescribed, triggered a fatal heart attack. His family say that all along they've just wanted the truth.
We had never set out on any kind of a witch hunt. We never wanted anyone to lose their job over what had happened to our dad. But we felt that the standard of Dad's care over those 2 days was obviously extremely poor. What we would like to see is that for the doctors and nurses who were involved in Dad's case, where their performance was less than competent, there should at the very least be a note on their record to say what had happened and that they've been involved in this.
It's a statutory duty to report such deaths to the coroner. It took the Trust 6 months to report this death. Held 3 years later, the inquest revealed a catalogue of failings.
My dad's death should have been immediately assessed as being a serious adverse incident. It should have been immediately referred to the coroner without any question. There should have been an open and independent investigation. There should have been lessons drawn from that investigation, and systems should have been put in place so that nothing like it ever happened to anyone else again.
During the inquest, the family received an apology. The Trust's medical director, Dr. Peter Flanagan, said their father had died as a result of mistakes made by clinical staff of the hospital. He also apologised, in his words, for the major mistake he had made in advising that there was no need to inform the coroner about the death. Last week, days before the minister went public with details of a review, the Trust again wrote to the family. In that letter, Paul Cummings, as Senior Director at the Northern Trust, offered to mark Mr Cormican's death with a donation to charity or the purchase of a piece of art.
I would have thought to channel their energies to improving their services would have been better for Dad's memory rather than a piece of art with his name on it. I don't see the logic in that at all.
The former chair of the Northern Trust's board said the death shouldn't have happened.
He should have reported to the coroner. It was a major incident, but inside the hospital, very, very busy hospital, very difficult situation. Underfunding is the core of all of these issues. It's just unreasonable that people are expected to work in such difficult circumstances.
This afternoon in the Assembly, the Health Minister confirmed that not all families have been informed of details and said he was considering new guidelines described as a duty of candour.
We certainly are open to the idea, but I don't think it is the entire solution. I think it may be part of a solution. And for instance, in some of the cases we have heard in the media, there may have been a lack of communication with the families, and that's very clearly an issue.
Neil Cormican had 17 grandchildren. His story is just one of several, not just in the Northern Health Trust, but across the health service. Marie-Louise Connolly, BBC Newsline.